the chance if you lived in temporary accommodation as a child that you'll be homeless as an adult is like virtually causal. Hi, I'm Laura Nielsen and welcome to Hope in the Deep End. We've put together this podcast to inspire us all to keep working in areas of deprivation and poverty. We're sharing best practice, stories, outcomes and some interesting thoughts and ideas. So whether you're working in primary care, secondary care, the charity sector or any of the other myriad of roles, please listen and help us to keep each other inspired. Welcome to the Hope in the Deep End podcast. This week we are talking to Alex Bax, who leads the Pathway Inclusion Health team. And Alex and I go back a long way, and we both have been interested in homelessness for a while. And today we're going to explore some themes of homelessness, some of the ideology that may be in our society, and we hope that along the way we inspire you to think differently and be compassionate. So you came into homelessness through kind of local government routes, really, in a kind of slightly meandering way, which a lot of us come into the work of homelessness through quite strange routes. And then you land in Pathways. So what is the aim of the Pathway team, or what was the aim at the beginning, and has that changed?
I don't think it has changed. So the aim is a kind of twofold aims, I suppose. So first of all, to transform health and care quality for people experiencing homelessness and other groups experiencing kind of multiple exclusion, brackets within the NHS, and brackets of a complete commitment from foundation to free universal taxpayer funded healthcare as being the best way to respond to drive more resources to people who need them most.
Yeah.
And the second parallel objective was to make the fullest possible contribution while doing that, improving care quality and care outcomes for people, also to changing the wider circumstances for people, which have led them ultimately to the street. So that upstream focus always in our minds, while from the beginning having a kind of a very laser-like focus on care quality, I suppose, at the sharp end, and that sharp end initially being patients admitted to the street into hospital.
Okay, so the other group of people that I see coming out of homelessness, which you must see as well, is people who come out of statutory services. So people who come out of prison, care leavers, coming out of the armed forces, asylum seekers when they get leave to remain, seem to just end up in this awful place with no housing. What's your kind of feelings on that? I just get endlessly frustrated that we seem to be building these systems that perpetuate this when it's quite predictable.
So yes, I think the care leavers, the people leaving institutional settings, are a very significant group always within the homeless population, and they are precisely created by the structures, the lack of adequate structures in our society to catch people as they fall. I've been thinking recently, I quite like the phrase safety netting, but that we should have a society which supports people appropriate to their needs, particularly when they're vulnerable. And we know these are vulnerable moments. We know, for example, late adolescence is a difficult time, and kind of how blindingly obvious to think that care leavers, by definition, without the familial support around them that others might have, are going to need a little bit of extra help. And you would have thought it's not. Indeed, and that's what I was saying. We see lots of pilot investment into projects, and what's depressing about them in a way is that usually if you put some money into some good people to do something, it works. It actually doesn't. It almost doesn't really matter what they do, as long as you've got some people with the right attitude and the right kind of compassion, if you like, and commitment, that you get a benefit. So it's simply about having a sustained focus and turning it from a problem which you hope is going to go away to thinking about a system where you're setting up services and structures to support people when they need it, rather than turning them off and on again. John Connolly at our conference last year did a really interesting presentation about how many health services and other services tend to pull away from people when they're better, quotes. But of course, none of us are better. We have fluctuating needs in our lives, and sometimes we need a bit of help. And if the people who you rely on for support in a crisis suddenly walk away from you when they say, you're now over my threshold, I can't help you anymore. It puts you right. The risks are still within you and still around you in the society, and you're at risk of falling back down again. Of course you are.
And I think that's really interesting. So we there's lots of conversation in there about ending homelessness, and I think actually the call to kind of think really strategically and upstream, and not upstream as in but upstream in, you know, that universalism, and also the way our systems run. So you were telling me earlier that you know, prison doubles your chance of becoming homeless, because when you come out of prison, often you're given a very small amount of money and nowhere to stay, and you kind of have to get yourself sorted and meet a probation officer, and just in itself that is designed to perpetuate homelessness, isn't it? It might not be the people's intention, but our system is perpetuating it. And then if you talk, to go back to your young person with mental health problems, you know, that is actually, it shows, doesn't it, the importance of CAM services, of universal provision, you know, of primary care having some kind of long-term relationship with people rather than just, you know, on an app or you know, that kind of way. So it's interesting, isn't it, how key relationship is in all this as well.
And again, that's back to the lovely big meta review that Nigel and co did, ending up in the Lancet, finding that at the heart of good care for the groups of people who end up in homelessness, particularly in chronic homelessness, one of the phrases which just sticks in my mind is a trusting relationship with someone who cares, being at the heart of what helps people. Again, you kind of think, did we have to do some research to prove this? It's kind of, is this? It sounds like a blindingly obvious finding, doesn't it? Really.
Well, and it is, isn't it? But we live in a world where if there isn't a paper that proves it, it doesn't exist, and that I find personally endlessly frustrating. That there's very little room for just common sense now if you haven't got a research paper to prove it. I think it's really fascinating. I think what we do as a society and how we think, first of all, perpetuates problems and then makes them more likely for the next generation. We've doing a piece of work looking at children living in temporary accommodation, and the chance if you lived in temporary accommodation as a child that you'll be homeless as an adult is like virtually causal, and yet we don't seem to be bothered about preventing that trauma and that uncertainty in children's lives. So it's kind of there, isn't it? We kind of know why this is happening.
And we know that but we also know that, so we can see that at that individual level, like that multiple bereavement in a child, the things which we know are going to be really shit for somebody. We know those things. We know that being in care is terribly difficult. It's a difficult place to live your childhood, isn't it? And you could imagine making those care settings much, much nicer. But even so, having lost those early attachment figures are going to leave you with some challenges. So and we know all of that, but we also know at the structural level, we know that poverty, that a benefit system, so UK benefits compared to Europe are catastrophically low. We have the poorest poor people. They're beginning to say some of the poorest poor people in Western Europe, possibly in the whole of Europe now, live in the UK, despite us being on average a rich country. And we seem to have forgotten that. So for me, a big part of this is also that gross 40-year turn away from having a proper social security system. I think in Germany, if you lose your job for the first 6 months, you get 90% of your salary, then it goes down to 70% of your salary. So you're not stigmatized. You're not immediately thinking, oh my goodness, failure, etc. So you have a decent support for people. And when you support people decently, which in itself is a marker of respect for those people, it turns out their own abilities to engage in life are also much enhanced. And we know
that's really fascinating.
We know this.
Yeah, that's really fascinating. So you think, particularly as work changes so much, we're all at risk, aren't we, of losing our jobs? There's very few people who know that they're completely like stable. That's well gone, isn't it? I think definitely my generation and the younger generation. And so, but if you knew that if you lost your job, then you had this window to breathe again and go again, that is so different from being shoved onto universal credit and not being paid for 5 weeks, and going into rent arrears straight away, and not being able to pay a gas bill, and going onto prepayment meter. And you can see how quickly as a society we take people into poverty that's then really, really difficult to get out of. It's just staggering.
And I think there's also something which we also do as a society, which is also deeply insidious, is the discourse of what's the most recent incarnations of it, kind of Shrivers and Shirkers, the whole discourse that because as a society we put markers of shame on the whole welfare state, in a way, was a response to the shame of the workhouse, you could say. And it was an effort to say we realize that is wrong. That degree of social shaming of being in need was known. We knew this in the 20s and 30s. That's why in 1945 Beveridge, we changed it to stop stigmatizing people because they need a bit of help. But the last 40 years, Thatcher, since then, we've been right back in there with a press narrative which frames that in people's minds of themselves. Oh my God, I'm on the dole, I must be a failure. Which, if you go to countries with very well-financed social safety nets, that's not what people think of themselves. I've lost my job. Everybody loses their job sometimes. Oh, I'll take a couple of months in the garden and get a new job. It's not.
And the costs are comparable, aren't they? Because what's interesting is that if you prevent trauma and you prevent insidious poverty, then the costs overall are less, which we just cannot get our heads around systematically. I also think I think that kind of narrative that everyone will lose their job is really helpful, and that's definitely not one that we hear, is it? Or everyone in life is going to be bumpy. You know, we are going to have bereavements, we are going to have relationship breakdowns. Most of us will at some point will have a mental health problem. Most of us at some point will have a physical illness in our working life. Most of us will have things that are completely out of our control. And yet somehow our narrative is that if that happens to you, then you've dropped the balls, haven't you? You know, we were talking earlier about our
it's
kids.
your fault, and almost immediately must be your fault.
And we were talking earlier about our kids, and you know, I've got teenage kids at the moment, and you know, there is an unpredictability in them that then does have a knock on to you, and even as something as simple as that can be enough, can't it, to swing people and swing relationships into swing situations. I was really hopeful in COVID. It sounds a bit bonkers, this, but I was really hopeful in COVID that we would start to see like key workers as key workers, and that's not because I was a key worker, because it was. But you know, your story of someone, the dustbin man and the people who work at the supermarkets and the Amazon drivers and all that kind of stuff are completely key in our society. And I genuinely know I could not do a day on the bins. I'm not physically strong enough. I get cold. I would find it really miserable. I don't like, you know, I don't think I could even walk that far, if I'm honest. You know, when you see them walking behind the lorry and you're trying to overtake them. And yet that is, you know, without somebody doing that job, you know, our life starts to crumble, doesn't it, around us? And so how we see people is really interesting, isn't it? Really interesting. That's an interesting challenge. So we're going to try.
I think there's a narrative there. I was just thinking there's this word dependence, which has become, again, in the right, dependency cultures, people depending, and it's so strange that they've managed to say that depending on somebody else is has become characterized as being a bad thing, because actually, as you've just said, we all depend. Being a social animal, we depend on each other. Humans die if they're alone.
But I find it really fascinating that it is from politicians often, and business leaders sometimes, who talk about it, but then, you know, they can't get anything through the House of Commons unless they collectively work together. They can't hold a cabinet together if they kind of keep sticking the knives in each other. You know, you can't run a business unless people depend on each other. So in one way, we really foster dependency and interdependency, and another level we shame it. And actually, it is we can't. No, very few people can function as an island and be well. it's a very unusual life actually, and most of us are connected in families or communities or networks of friends or work colleagues or just people down the pub, or cafe or something, and that it is really important.
Yeah, absolutely.
Really important. I think I think the time that I found life the most difficult was when I had my first kid, and obviously it was a bit of a shock, but also it was the time I was the most isolated, I think, and and it was just really interesting. I've got lots of resources, both kind of in me and but actually that time was just really difficult, and it was because one of the reasons was when the social connections shifted so quickly. So it's really interesting, isn't it?
But, and I think that loneliness, I can't remember the data, it's something like loneliness in old age is equivalent to smoking 20 Benson hedges a day, isn't it, in terms of life expectancy?
Yeah.
So we know that how we feel affects how we are.
And it's amazing, isn't it? I went to see somebody the other week who sent me a message afterwards just saying that they were very, very lonely. And it was somebody who I would never have thought was lonely. Like, they were just had all the kind of resources that you think of life would need and more. And yet they sent me this message saying they were lonely. And I was like, wow, it's incredible, isn't it? One of the things we want to do in this podcast is not depress everyone. So some of the work that Pathway's done has been really has shown that change is possible. So I just want to finish off by exploring, if you're working maybe in an area allied to homelessness, so maybe you're working in like healthcare generally or social work generally, or you're just somebody who's interested, can we talk about some things that change is possible? You said earlier that almost every pilot where you give compassionate people some resources works. So that means that actually there's probably quite a lot of options for us. So if you're in a hospital setting, how can we make homelessness better? If we're in primary care, how do we respond? Any of those tips?
So I think it's right. There's something, again, as a charity, sometimes we've found our role in a way to be trying to create some space around people, to protect them, to do sometimes the fairly obvious. Sometimes there's a little bit of extra innovational, and again, it's back to that dependency. If you bring together groups of people, particularly sometimes groups of well-trained, expert, experienced people, you get really good things to happen because people are amazing and they bounce off each other. So trying to create a bit of space and time for people to think, I think, is one of our simple successes, which also has the effect of keeping people who perhaps are also working in a frontline setting, can help that headspace to think, to keep your intrinsic motivation going is a little bit magical, I think, somehow. I remember again back very at the beginning with Nigel Hewitt and Trudy, and we hadn't really formed. It was me sitting in actually sitting mainly in the British Library with a laptop.
There's worse places to sit, Alex.
And going to meet Nigel, who'd just come off kind of another morning in the hospital, trying to understand why everybody hated the homeless patients and trying to work on some of the relationships. I remember him saying to me, it's so helpful, Alex, to know that you're over here thinking about what me and Trudy are doing, even though I haven't spoken to you for a week. The fact that somebody else's mind is out there thinking about our issues is actually giving me a bit more oomph and desire to proceed, and I feel a little bit more protected, and I've got someone to talk to. And when I'm having a really bad day, I know that I've got someone to talk to who's that bit removed. I think as Pathway, we're doing quite a lot of work. We've just done a big supported a lovely PhD clinical psychologist student looking at trauma and vicarious trauma in staff. But one of the parallel findings there is that techniques like reflective practice, those team-based relationship consolidating, and time for reflecting and processing in an organized, structured way, is protective and is really helpful for people across the range of dimensions in terms of their work life and their life as people. So I think there's some. And again, we'll know that in a way, but back to the research question, it's becoming clear that that is the case.
Yeah.
And that if we do think of good ways to protect our own people, if you like, then they're also able to go on doing the tough jobs people do more, and sometimes to go further and push boundaries.
I think so what you said there is allowing people space to reflect and think and process their work environment is really important. And I think we would totally agree with that. The other things, just so we can point people to some resources if they want to, is that if you're interested in homeless healthcare at all, then you're always welcome to join the Inclusion Health Network. If you go to the Pathways website, you've got a Pathways conference, haven't you, in March that people can still book onto. The other things that the Pathways team are really good at
and also available online.
And the other thing that the Pathways team is really good at is they are brilliant at lived experience, getting people with lived experiences, not just views across and not just heard, but really shaping how things develop. So if you're interested in that, we might do another episode on lived experience at some point, because it's something that a lot of us struggle with. We know we should be better at it, but we struggle with it. And the final thing to say is that if you are working in a hospital and you know that you've got an issue with the outcomes of your patients who are homeless, then the Pathways team have developed ways of working with patients in hospitals and giving wraparound healthcare in hospitals. So it's really pragmatic. It can be as simple things as like making sure that there's a sensible detox protocol that junior doctors can write up. It can be as simple as making sure that patients have access to TV cards. They've got a way of doing ward rounds with a GP supporting, so you get much better health outcomes. So it's a compassionate response to complicated medicine, to generalism, and it's got some amazing outcomes. So if you're in a hospital ICB, or if you're in a hospital trust at the moment and you're looking at your bounce back data, we know that people who are homeless are some of the most frequent bounce back attenders, and they have the poorest outcomes in healthcare. So the Pathways team are always up for new partnerships. I'm selling a product here, Alex, for you. But we'd love to see good practice spread. And that is one way for it. And the other thing we're encouraging people to do is, if you're working in primary care, is be really proactive about people who are in difficult circumstances. So we'll say, because we're going to say it quite a lot, if you are registering patients at your practice, they don't need an address, they don't need a passport to register. If they don't have an address, you can use your practice address instead. We open up our staff shower for people to use. They generally don't actually use it very often. So when we started it, our staff were really concerned that there'd be somebody there every day, but actually people, it's just sometimes that shower on a bad day before other resources come in. Be really aware of the impact of trauma, and we'll talk about this another time. But I think Alex's plea for us all to be kind of compassionate humans when we meet other humans, in whatever circumstances we're in, is one that we can try and do, can't we?
No, I think you've just nailed it, Laura. I mean, really, all of those things are incredibly helpful. But the basic way of how people carry themselves, I think, is such an important thing, and it takes a bit of doing, I think. But we've all got that capacity within us, I'd certainly think.
Yeah, and the other thing to say is that you can get it wrong, and that's fine. So, as I work in medicine, there's times when I've absolutely nailed an interaction with a complicated patient, and there's times where I think, oh, I know what I'm doing, and it still goes not quite right. And there's times, there's a gentleman sat outside my local co-op at the moment who's street homeless, and I, even as people who work in this field, the kind of compassion and intellectualism of, do I buy him another sandwich, and does he want a sandwich, and can I give him money? That's not very helpful. And I'll talk to him, but then is that helpful? And all that kind of stuff is how we all feel. And the thing is not to shut down to that, to kind of sit in it. And some days, I've got time to sit with people and talk to them and ask their name and stuff. And other days, frankly, I'm just trying to get some dog biscuits and get my kids off to school, and I haven't got capacity to do it. And so, all of this we all sit in, but the biggest thing is to keep our eyes open, keep curious, and keep compassionate. We hope that we hope that this has given you food for thought. It's definitely made me think. Alex is always fascinating to talk to, and I'm sure we'll return again to talk health, talk politics, and talk hope. Thank you so much.